This is a beautiful case because it demonstrates very, very nicely the appearance of carcinomas relative to their normal tissues or cells of origin. This is a large bowel. It has been opened longitudinally. This generally whitish area here is the thickest, most strongest part of the large bowel. It's the muscular layer. The serosa and fat are out here. All of the stuff here on top, on the north, is a mucosa. Note that we have a uniform rim of mucosa here. We have an abundant amount of soft, yellowish, fatty, vascular submucosa. We have a good amount of uniform wall or the muscular layer. And then we have looser connective tissue and fat. Notice how this mucosa kind of all of a sudden becomes no longer uniform, and it is thick, and it gives rise to this mass which is irregular, and perhaps it may even infiltrate, as you can see here, into the muscular wall as well. Notice that this whole thing here can be very, very easily described as tumor. I think when you get back out here again, you can see more of a uniformity of the wall. It looks like this may be submucosa. This may be a thin rim of uniform mucosa again. So my guess would be that I'm going to exactly delineate the limits of the tumor right now. And let's see if we could make that correlation now with the microscopic slide as well. Just as though we went through the normal layers grossly, let's look microscopically. You could see a uniform circular smooth muscle layer here constituting that white line. You could see a looser vascular submucosa here. You could see a uniform mucosa here, and you know that it's colon because you could see that these pits lead into these crypts here. It's not papillary. It's not gastric. There's no submucosal like glands. This is classical colon. Notice how the uniformity of the normal colonic mucosal architecture extends up to about here, up to about here, perhaps up to about here. But then look, all of this is cancer. All of these are irregular, malignant, infiltrating glands, not looking at all like they should look like, whereas all of the glands here are delineated and structurally normal. Also notice how the muscularis mucosae is nice and thin until you get to about here, and then it's disrupted by this tumor, which is extending glands into the submucosa. Of course, we didn't see the part where this may have gone into the muscular wall, but this is a beautiful slide to demonstrate the difference between normal colon mucosa having an abundant amount of mucin in the glands. Here's a normal gland. Here's a non-malignant gland. Here's a non-malignant gland. All of this is normal mucosa. And then all of this is cancer. Now, what these 3 or 4 glands are might be up for some debate. I personally think these 2 are probably not malignant because they have a nice mixture of goblet cells like you could see there. But all of this stuff here is malignant, and I wouldn't want to have to guess on these 2 or 3. I really don't want to do that. Notice how the muscularis mucosae is nice and uniform here, but in the area where there's cancer, it appears to be absent because this cancer has infiltrated through the muscularis mucosae into the loose, very vascular connective tissue of the submucosa. Once it invades beyond that, the prognosis changes greatly from about 100% curable to, maybe we better look at the lymph nodes very nicely. Notice here's some inflammatory reaction. Normally you can have a few of these nice secondary lymphoid follicles within the submucosa. Anyway, let's look at this glands a little more closely. Notice how they are quite variable. There's a mitotic figure. There's a big, dark, ugly cell. There's a bumpy cell. They don't hardly at all look like each other. However, when you go to the normal colonic glands for comparison, the ones that have not infiltrated this muscularis mucosa, notice how you see a nice mix with goblet cells. Notice how the nuclei are small. Notice how they stay towards the basal surface of the gland. And this is a classic demonstration to show you the marked difference the way normal colonic mucosal glands should grow and differentiate versus the complete haphazard infiltrative process of an adenocarcinoma of the colon. And thank you very much.